Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hanna
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Welcome to a next episode. We're talking about missing teeth.
Yes. So we've had a few episodes on extractions, and now is the time to discuss how can we replace it. Like, I don't want to be with a, missing tooth or like a gap in my jaw. What do I do? And what's the best solution in your eyes?
So we were talking a lot about wisdom teeth. So now we move on, and we basically, I think the majority of clients, they come and they're missing their first molars because they are the teeth which they come through when we are 6 years old. So I have seen online the book which was called The Money Tooth, which was referring, is it a joke? So it's because
why money tooth.
Yeah, it was from the surgeon, from a colleague from States, I think, who was teaching the techniques of removing the teeth, which is also the skill, how to gently remove the teeth. So the first molars are actually the most seen teeth which are missing or has root canal treatment, which means that if you have a cavity or trauma, then the part of your tooth, which is the inner part of the tooth, which contains blood vessels and nerves, is affected, inflamed. Lots of dentists would say you need a root canal, and it basically means that you destroy all the vitality of the tooth and the tooth become a dead part of your body. And I don't think it was ever a good idea to leave the dead part in your body. And I believe we will be seeing more and more transformational stories with clients, with the biological dentists all around the world, changing people's health lives because of removing these root canal treated teeth, because it's a hidden inflammation, again, hidden source of toxic bacteria which are flowing in your bloodstream. So
before you start, Eva, why is it money tooth? So I'm just going to explain to people. So basically, you spend money for this tooth. Eva said, this is a tooth which evolves in your mouth when you're 6. So imagine that you're 36 and you've had this tooth for 30 years. So because we've been using it for so many years, many people do have a decay, which means they need a filling, but then
the filling is amalgam filling, it increases in size, the decay develops underneath, there is a fracture, you need a root canal treatment.
So most dentists would do a root canal, not us, but most people still do.
And then the root canal treatment fails, it gets inflamed, you have lots of pain because it's again connected with the nerve system, it's a trigeminal nerve, so the whole body hurts, basically one part of the body hurts. And you have the tooth removed and have implant. And usually it's a titanium implant, which is inflammatory for the body too.
So maybe let's stop and maybe for a few minutes, because this could be for another 2 hours discussion, but let's talk about root canals and why we do not recommend to have those done. I very simply tell my clients to imagine a tree, like a tree with a lot of branches, because that's exactly how the inner part of your tooth looks like. So there may be 3 main branches, but on the 3 main branches, which will equal the 3 main nerve roots or like path, and this may equal the 3 branches on a tree. But on a tree, the 3 branches have got how many? Millions, maybe trillions of little branches where, they get the leaves. So I always describe it to people like that because they can imagine how complex the nervous system in your tooth is. So basically every single tooth is a living organ. It is a wrong perception that the tooth is just a tooth and we can build it, we can, repair it, and we can kind of shut its mouth up, like, just to compare it. But it's not. It's a living organ, and it's the complexity of the nervous system is immense, is amazing, it's great. And, in past days, like years and years ago, decades and decades ago, they used to take your tooth out when you did have like a deeper issue in your tooth. So whenever, you've had a problem, they took the tooth out. Or if you had a heart operation scheduled, the one of the pre-operation assessments, you needed to see a dentist if there's any like a focal infection, and root canal was considered as a focal infection, meaning, that's a dead part in a body. It is alarm for like a systemic consequences, for a systemic inflammation risks.
Source of bacteria.
Mm-hmm. And it needs to go out before the surgery. So you don't get a sepsis, you don't get like poisoning of your blood, so-called. So that was years ago. But then someone was like...
someone
was clever and just like, in a sense was clever because he or she thought, oh, why don't we actually try to, clean the root canal and just stuck something in so we kind of, the tooth's not going to be hurting. And it worked. Like, we know that even the endodontists, the specialists who are using microscopes and, special protocols to clean the root canal, even they said it's not 100%, and they see it's not 100% treatment. But what is, I know. But on the other hand, they haven't done the research of taking the tooth out and seeing what bacteria is left there and what the consequences are. So they might have shut the tooth up, kind of, so it doesn't hurt, but they haven't thought about other parts which are connected to the tooth and which are actually reacting to the inflammation, which is still there, to a deadly, because it's a dead organ. So it's just, breaking into like a toxic environment around the tooth, and it harms your overall health. Mm-hmm. So
then I love that we have lots of data, and I love to say that we're part of the community of biological dentists, and we elevate each other, and it's a beautiful community, sharing the data, sharing the wisdom, and sharing the experience. And I love Dr. Kelly Blodgett. He does, for years, he sends root-treated teeth to the lab for
when
DNA.
He extracts it, when he takes it out?
Mm-hmm, for DNA test, even though they look from Western perspective that everything is fine, and 99% of dentists would tell you this root canal is okay, it does not cause you any issues. But he sends it to the lab, and he shares every Tuesday, which he calls Toxic Tuesday. He shares the panel of toxic bacteria. What really surprised me, that you can even find a botulotoxin in these samples, and which is the toxin which is not, your body needs to be so strong that you survive this toxin. So there is a panel of parasites, bacteria, and viruses. And now I think it's a body has some resilience, and that's how I am resilient. If I can manage this dead part of in my body, and I don't have any consequences, any signs or direct signs. Or I'm not that resilient, the immunity is not, and I have issues, and now we're back to Chinese medicine. If I have issues that I have chronic urinary issues, then the front teeth, I heard when I was a child, I have a root canal, usually like that. I have a root canal in my front teeth. And we see lots of connections past 8 years, and we see the transformations with clients if they decided to have the root canal treated tooth removed.
Maybe we will record one more separate episode about a documentary called Root Cause, where there's this main person, it's based on a true story, and he's got a story about like his root canal after an attack in his front tooth. And I think that would be something really nice to share, Eva, complexly, so people can see the documentary.
Yeah, I think part of our journey is to educate clients and people all around the world. That's why we started this English podcast, because we can reach more people with English. And I think that it's very big part in us to educate people and show them where they can find the information. So one very important things to see is the root cause documentary, which is on our website in our library. And it's important that people, they can educate themselves and they can make their own decisions, but they have to have information behind it. So,
but also sometimes, when you see someone who might look similar to you or had similar issues, you might easily better relate to the problem and see it from a different perspective. So I always say to our guests at DuoSmile, I can just be speaking another hour, an hour and a half, and I wouldn't describe it better, because this movie is just, based on true story. It's a real person. It's a real story. There are specialists who are describing, not only the dentistry, the whole body in a complex
cardiologist
way.
Dr. Levy, and we will, in the next episode, we will share about this documentary.
Yeah, but if you're excited and you want to see it right away, just Google root cause documentary and it's going to come up. So, did we say everything about root canals? So that's the reason why we do not recommend to first even consider having it done. And second, we do recommend to take the root canal treated tooth out and replace it ideally right away with a ceramic implant. So maybe, and that's the answer. How do we replace the missing teeth? Good news is that you don't have to replace the wisdom teeth. No replacement. But and that's kind of common sense obvious, because if there's not enough space for it, how can it be another space for a new wisdom tooth? So no wisdom teeth replacement, but we do replace every other teeth. So Eva was talking about the tooth which we see the most, which is damaged or missing, which is tooth number 6, upper or lower.
First molar.
And so how do we replace it? What are the options?
So the options, we always have the options to leave the gap there. So that's the option.
That's the option.
The other option would be to replace it with a ceramic implant. And the last option would be, the last option would would be bridge. One of the options would be bridge, to bridge the gap. And one of the options also would be to close the gap with the orthodoncy, which is braces. So we have 4 options. We leave the gap, we do the orthodontic treatment to close the gap, or we do the bridge, or we do the ceramic implant.
And so all of the options, and needs to be considered in every single case. So I wouldn't consider a bridge if, there's a 1 tooth missing and there's 2 healthy teeth on both sides. I would never ever do bridge, because that means I would need to kind of destroy the 2 teeth next to the gap in order to place a bridge on top of the, missing tooth. So I wouldn't do that. So every case, I am trying to say that every case needs to be considered. And what I perceive, in my eyes, the best solution is to replace the tooth, because what I believe the nature created in our, mouth, certain number of teeth and in certain positions. And if there's a one missing, it has had a reason why, it has had a duty, it has had a,
there is for a reason. So
there is for a reason. Maybe
if not, then, the back is disaligned, it's all the harmony of the body, of the system.
Forces when you chew, like Eva just said, not even the forces when you chew, so they're spread evenly, but also it is connected with our spine, our jaw equals our hips and everything in between. So if there's a disalignment, it can affect not only your chewing, but it can affect whole your body, meaning spine, meaning even, the jaw, the hips, everything, the way how you walk. So ideally is to replace it. And the way how we love doing it, DuoSmile, is to replace it immediately. We call that immediate implantation. We use SDS system, which is a ceramic implant. In my eyes, I have not seen anything which is better. It's the best of the best. Comes from Switzerland. It was invented by a dentist who have been placing, he said he placed like 30,000 implants. That's crazy.
Dr. Ulrich Foltz, and he is a big inspiration for us, for our clinic. It's top of the world treatment and support of the body to heal.
Yeah. But the reason why I was saying this and even mentioning the number of implants he did is that he, after 30,000 of implantation, he knew how he wanted to invent the implant. So it's not only biologically inert and, like
the material
doesn't trigger your immune system like titanium, but also like its shape, the fact that it's one piece. There's no like gap in between what titanium calls implant and abutment. There's no kind of gap in between. Like technically, in between abutment and implant in titanium form, there is a small gap, and that's exactly a gap where all the bacteria comes over, and that's why there's such a big failing and failure data for a titanium implant. So one of the reasons is this.
Plus, also it's the material, because it's a metal, and even though they say it's a pure titanium, there is always its alloy.
Yeah, so there's different brands, and different brands do share different data, but we know that
they don't share them as well, because it's the secret of the company. But we do see transformation for clients who replace the titanium implants. So
it's good that you've mentioned this, because like SDS system is maybe the only system in the world which has been like, they've got the stamp for a clean produced material. Mm-hmm. So which is really good also news for our clients as well.
Good and big news is that in Germany, this system is considered as a second option if the titanium implant fails, which is a big
you said it like a second option. It's like a first option after. So
that people have failed.
A treatment of choice.
Yeah, if they have a failure of titanium implant, because majority of people have titanium implant, then it's like certified and stamped that the option for the treatment is
the only option. Yeah.
Zirconia implant.
Yeah, the option of choice.
Which is great news, because for a long time it was at the side and very alternative for many of dentists, still is very alternative.
So why do we love it, Eva? So for me,
I love that the body loves it. And we love how the body heals with the zirconia. And also on a spiritual level, if you go and go and see the crystals, the zirconia is also crystal, and it's very grounding crystal. And I love even this part of the spirituality there. So
it's grounding. It's going to ground you.
And also, it's not only grounding, but also connecting you with divine. So it's absolutely beautiful. But what I love is to see the results of our clients, how they heal, and how the body and gum and tissues like to connect with zirconia.
Yes.
Now you have to get ready for it again. So it's not that you would come very next day for the implant placement, but again, we have the bone healing protocol and lifestyle changes month before at least and month after. We do have no gluten, no sugar, no alcohol, no caffeine, no dairy products, conventional dairy products, and no smoking. And we're adding more protein in as a macronutrient, and then we supplement minerals and vitamins.
So it's based on a high doses of vitamin D, D3 specifically, but there's not only D. Like the D always needs its friends in order to get into the cell. So magnesium and K2.
Calcium to get to the cells. And it's very logical. If you like biology and biochemistry, it's beautiful. And I actually love naturopathy because it's all about details and Krebs system, which is the energetic system of the cells. And it's very smart. So the body is smart. We need to lead our body a certain way and give him right tool in order to heal. So we have this month before protocol
and months after. So when the body is and the client is ready with this a month's regimen, then we can start with the treatment. And again, similar manner like extractions, people do come one day before their treatment day and the day after. So it means usually takes 3 days. One first day, minerals, vitamins, and all the growth factor, kind of a cocktail
boost
in your
immunity.
Cocktail in your veins. So it's intravenous. It takes about an hour. Then the second day you come for the treatment. The beauty of the ceramic implants and the immediate implantation is that you are working with your body's mechanism in terms of healing. Because if I remove something and clean it, we use ozone as well, we use plasma as well, then we right after implant the ceramic implant in, and the body kind of might be thinking, oh, like the signals, oh, there's like, it's not maybe the root, but there's something similar. Let's just heal it. Let's just
embrace it.
Yeah. Embrace it and incorporate it within the bone.
Integrate it.
That's what's happening. Vice versa. If you imagine what the conventional way is, and sometimes, to be honest, in some cases when there's like a massive destruction of the bone and we cannot place the ceramic implant, it can happen, but most of the times it is possible. So the contrary is with the titanium, what usually happens is that they remove your tooth and then they said, wait 3 to 6 months time, and then we will place implant. If you imagine right after the extraction, the body needs to work again and spend all the metabolites and vitamins and minerals to close the gap after the extraction. Like, first of all, when you do it like that, like only by healing the bone, closing the gap, you're losing 30-40% of a bone already. So that's one thing. And the second thing is, like, imagine like you opening the wound again. Would you like to have like 3 times in a row operation of your like gallbladder? I wouldn't. So I just always just say it's always nicer just to take it out and then work with your like body's mechanism and use the primer healing regulations and like
I would say the power of heal. The body has immense power to heal. We just support the body to heal with all macronutrients, micronutrients, and all the goodies we give the body before in intravenous way.
Yeah. So same on the day of treatment, you get 3 different kinds of intravenous support, and the day after you get another support in terms of, again,
vitamins, minerals, but also homeopathy. So it's all goodies. We don't share the details because it's a beautiful mixture, which is very nice. And we love to see clients coming very next day with no swelling and
no pain.
No pain. We are just giving them also a cooling mask to take home. For
like a little box.
Night. For the first night is a mask, which is cooling. And then the third day, they have another boost of immunity.
And then you come over 4 to 6 months later when, the implant is integrated in your bone, and we will make you a beautiful zirconia crown. What is the beauty about this is there's no drilling in, no screwing in. This is like really simple, beautiful preparation of the zirconia and placing like in the next, taking impressions, and next appointment you get a crown. So it actually, even the ceramic implantation can save you time and money because you get so like much less of the appointments you need to see the dentist for. So I love it.
And we also love it with our dental lab as well, because even though the lab is not with us in the building, we do share lots of experiences, and they also have other dentists they work with. So they see huge difference in between using the zirconia crown and metal fused or
porcelain fused
on metal crowns,
or metal crowns,
which are, they're not favoring to body. They're very inflammatory, and the tissues, they don't like that material. So even the lab technicians, they see huge differences in between zirconia versus metal.
Okay, so I think that was like briefly.
That was very brief, but I think it could be a lot of information. So I would love to share the root cause documentary in the next episode. I'm looking forward to that.
And more about implants probably in some, later episode of Healing Through Dentistry. Thanks for listening and look forward to seeing you next time.
Thank you for joining us on Healing Through Dentistry podcast.
We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.